Shashi Tharoor, Siri.
Thank you, Mr. Chairman, for allowing me to speak today on a topic which, frankly, has not been easy for us as a society to deal with. I must say that mental illness has been an issue which, by and large, we in India have preferred to brush under the carpet in the hope that it will go away or that it really is not something we have to deal with. But the fact is that we do need, Mr. Chairman, to acknowledge, to understand it, to take measures to do something about it, because the big elephant in the room is, in fact, the fact that every one of us actually knows somebody who has a mental health problem. We don't realize it, we may not like it, we may not be aware of it, they may not be conscious of it, but I can assure you not one of us in this room has failed to come across
all in
people.
their public life, they have all problems.
Sir, Mr. Chairman, you're right, the problems are there, but we have not been giving this issue the importance it deserves, and that's why I think this debate is an important one. As our Honourable Minister has said, we owe it to ourselves, to our loved ones, to the future of our society to find solutions and grappling with it. We must stop looking the other way. Now, as a Congressman, Mr. Chairman, I'm proud that this bill was first brought to this House in 2013 by my esteemed colleague now in the Rajya Sabha, then the Union Health Minister, Mr. Ghulam Nabi Azad. He recognized early the necessity for India to take proactive steps to protect the well-being of our citizens. And I'm sorry in some ways that it's taken so long, 3 years, for the present government to bring it back. But I want to congratulate Mr. Nadda for his masterly exposition of the provisions of the bill, and for the government of today for having recognized the good work being done, and that was done on a number of issues by its predecessors. In fact, it is striking that we have now seen so many bills brought to the House in the last 3 years, 2.5 years, by this government, for which the preparatory work and very often the drafting were done by the UPA government, and this is one such bill. I think we all know there is Aadhaar, there is FDI, there is the insurance reform. So many other things have come to this House thanks to the hard work done by the predecessors of this government, and I hope they will also have the grace to acknowledge that this is the legacy of that hard work. Now, let me come back to the substance of the bill. The numbers in our country, Mr. Chairman, frankly, really plead for urgent measures. It is estimated that at least 1 in 20 people in India live with mental illness. That's about 5%. 50 million of our citizens are dealing every day with a problem that we are only now starting really to even acknowledge in all its gravity. And the fact is that experts think this may be an underestimate. By 2020, as much as 20% of our population might be affected by mental health issues. Yet, as I said, we've really ignored the problem, and very often when we have considered mental health, we have done so with ignorance and prejudice. Just let's look, for example, Mr. Chairman, at the past legislations on this subject. We have, for instance, the Lunatics Removal Act of 1851, the first legal provision on the subject. The Indian Lunatic Asylum Act of 1858, the Military Lunatics Act of 1877. Perhaps we may think they've all gone to the other side of the border, but still military lunatics had an act here. The Indian Lunacy Act of 1912. Now, these were all bequeathed to us by the colonial authorities, and I think many of you know what I think of many of the legal and penal provisions left behind by the colonial authorities. But the fact is that their only answer to mental health problems was to brand individuals as lunatics, confine them in so-called madhouses, and physically in certain spaces, and to pretend that took care of the problem. Even just before independence, 1946, there was a Bhure committee, a government committee of inquiry, which concluded, and I quote, "The majority of mental hospitals in India are designed for detention and safe custody without regard for curative treatment," unquote. But I'm sorry to say, sir, this has continued largely to be the pattern even after independence. Now, it was easy for a foreign power dominating a subject people to incarcerate individuals and continue with the business of ruling as they saw fit. But in independent India, our government is there to serve Indians. We must look after the health and well-being of our own people. We owe it to our people to find answers, not to just brand them as lunatics and look the other way instead of giving them assistance. It has to be admitted we are already late rising to the occasion. The 1987 Act which we are now here to amend, was first drafted actually in 1950. And it took decades of protracted debate even to get adopted 37 years later. By the time the Act was realized, Mr. Chairman, it was already out of date. It's no wonder that to this day, as Human Rights Watch, for example, has reported, inmates, particularly women and children in our mental health facilities, are treated worse than animals. Not only have our laws been stuck in this colonial era mindset, Mr. Chairman, our mindsets, our own mindsets with regard to mental health have also been frozen in time, frozen in history. As India looks to a new future in the 21st century, it must acknowledge the errors that we have made in the past. We must right long-standing wrongs, even if we have to accept hard truths and reorient our thinking. Now, it was only in 2007 that India ratified the United Nations Convention on the Rights of Persons with Disabilities, following which the UPA government commenced the process of overhauling the antiquated Mental Health Act of '87, and even the basics have had to be revisited for the better. I note from Mr. Nadda's bill that the term mentally ill has been replaced with person with mental illness, which preserves the dignity of the individual seeking the treatment. And I'm really grateful that Mr. Nadda has continued this kind of line of logic and approach and continued the good work. And on this, I want to assure you and the government that my party and I are with him. We agree there is no justification for India to continue to rely on outdated and patently unjust notions of treatment, so-called treatment, which really is locking people up. The world has moved ahead. Other countries have discovered better answers. The truth is that if we can focus on helping those affected directly, helping their families, helping them within their communities, then people afflicted with mental illness can rebuild their lives and move forward. And it is for us as a society, if we want to be a modern, progressive society, we must do this, Mr. Chairman. Mental health remains an issue that is not only difficult for many to comprehend, but it comes with a colossal baggage of stigma. Stigma that people think, oh, ye to pagal hai. This whole attitude that comes in, the way in which people are disregarded, despised. One is shunned as a mad person, a lunatic, or worse. If it is known that one has even been to a psychiatrist, one is looked upon by many people with fear or with confusion. What is the matter with this person? He goes and sees a psychiatrist. That is the attitude in our culture. A health patient is painted with the brush of ignorance and treated very often at a distance. This person is not well mentally, let's keep our distance from him. The real truth is this person needs medical assistance, needs help, needs understanding. It is an illness, it is not just a behavior pattern. The truth is, of course, that mental illness is a very complicated disability to gauge. You know, when you have another kind of disability, somebody is sitting with a broken leg, you can see he has a broken leg. Somebody has a broken mind. Extremely difficult to diagnose it. Sometimes people can, as far as their appearances go, seem perfectly healthy. And they're happy. They come across as social beings while confronting painful inner battles. And I can tell you, Mr. Chairman, from personal experience, there's nothing sadder than witnessing a close one, a loved one with mental illness at close quarters. I have lived with a victim of mental illness. Like many in that condition, very often such people are in a state of denial. They don't accept they have a mental problem, so they don't go to see a doctor. Nadda Sahab was talking about how they can easily authorize somebody to do this. They don't accept that they're mentally ill. One of the first symptoms of mental illness is an inability to recognize it and to be in denial about it. They're therefore unwilling to seek help, even after their behavior may raise questions about their mental condition. Very often you can see in public behavior that somebody is really not normal or right. And when you say, will you go and see a doctor, this is not right, your behavior, they will say, nothing wrong with me. And the truth is, it gets 10 times worse when it's private behavior that cannot. Often, even diagnosis is a challenge. There are many, many people, perhaps even in our own profession, Mr. Minister, suffering from undiagnosed mental illness. I must say that we need more people to set an example. A prominent film actress, I can't take her name in the House, but she has courageously spoken out about her battle with depression and how difficult it was for her to receive understanding, let alone help for her condition. And by doing so, she has brought some people out to seek help. But this is again part of the challenge. I would urge the minister to think in terms of how to use role models to go and say, I have had this problem, it can be treated, there is nothing wrong. And this is a big star in Bollywood, therefore her message gets across to the general public. Now, there are patterns, of course, that experts can notice, but where even seeking an expert's assistance is sometimes treated with stigma, many are reluctant to seek help. Stigma and the lack of a support system mean that most of them must fight these battles on their own. A frustrating, isolating experience that sometimes leads to such eventualities as suicide, which the minister mentioned. Sir, the National Crime Records Bureau has calculated in 2014 that at least 15 suicides take place in India every hour. That is 15 too many. And the fact is, 15 instances every 60 minutes of our collective failure to recognize the problem and solve the problem. This is what confronts us. This bill brings to the table an opportunity for us as a society to do better about it. Mr. Chairman, suicide is an issue. I'm very glad the minister flagged it, because our treatment of suicide and attempted suicide has been appalling. Suicide is now a leading cause of deaths amongst young adults in India. On the one hand, we sing songs about our demographic dividend and the potential of our youth, but do we realize how many of our young people are depressed? The world around us is changing constantly, pressures are mounting, there is economic necessity, there are academic pressures, there are jobs to be found, and there are no jobs in our economy today, despite the assurances of the Prime Minister. We know that. We've only created 1.5 lakh jobs last year when we need to create 1 crore. These are genuine problems. There are uprooted lives from villages to cities, from joint families to individual units. There is the weight of expectations, and there is a fast pace at which familiar cultural networks are being replaced by new and unfamiliar systems. And because people are lacking an anchor, lacking a steady base, because our nation is in a state of transformation, the result is that they are stigmatized. Our young population is lapsing into depression and disorientation. In 2013, 62,960 adolescent suicides were reported. And most of the 3,594 were even committed by suicides committed by children aged between 10 and 14. So these numbers obviously show that they had no one to turn to, no one to rely on, no help available. Our education system is wide, but we don't have counselors. We don't have counselors who can serve the mental health needs of our youth. We expect them to deal with the weight of expectations and performance pressures. Pariksha pass karo. This is the whole pressure coming from home and from their peers. And we expect them to do it single-handedly while we pursue them relentlessly to do this. And I hope the minister will not only take note of this alarming phenomenon, I hope that you can persuade your colleague, Mr. Javadekar, to make it mandatory for educational institutions to hire professionals who can attend to the mental health needs of our students and the young. It really is literally the need of the hour, Mr. Minister. Now, some studies have even tried to estimate the effect this has on GDP annually in order to try and persuade us to take cognizance of the issue. I'm not going to equate human life to any monetary equivalent, but let me say that our children are our future, and as more and more are falling prey to mental illness, to brush the issue under the carpet is to handicap the future of this nation just to satisfy prejudices. I know that there are many members across on the other side who represent the state of Rajasthan. We have Kota there, where so many students go every year to study, pass the IIT examinations and so on. Every month there is a suicide of a student there. Can we realize what kind of intolerable pressure we are putting our children under? So I do welcome, Mr. Minister, the decriminalization of suicide, your intention to look at the matter in a more comprehensive manner, but I'd like to call upon you to have a wider look on the points that I have raised and to ensure that law enforcement agencies and those who are the first responders in incidents of suicide or attempted suicide are sensitized to the issue. In fact, we should also sensitize our media to the issue. Sometimes the media reports suicides in such a way that it encourages other depressed people to take copycat actions and commit suicide also. We have to change not only our law today, but our mindsets. And that is a bigger challenge. It's a steeper challenge than just changing a law. And that's why, Mr. Minister, this bill must be accompanied by effective mechanisms for implementation. If we don't implement, this law will remain on paper of good intentions. I really hope that you will be able to give the implementation priority. We need a government-wide effort to ensure that your officers are sensitive to the needs of those in distress who are depressed. The police should be trained to understand that an attempted suicide is a cry for help. It is not a crime. Who is going to tell the police, Mr. Minister? I hope that you will raise this in the cabinet. It is not only just here today in this law. It is other ministries also that have to be conscious. In fact, if we treat attempted suicide as a crime to be punished, the police way is going to prevail over the human way that your bill is actually talking about. What we need to ensure is that people get help, they get guidance, they get assurance, that they get the helping hand that they are seeking from all of us, and then they find their way back to a happy and productive life. We owe it to them, Mr. Chairman, to extend that hand, to bring them back to a meaningful life and a life full of meaning, quite literally. Now, I'm sorry to say that our educational system is so much at fault in this particular problem, but it does, I'm afraid, the very institutions that we have created to give our children a future are also putting them under so much of pressure that their future is disappearing. There was a recent study, Mr. Chairman, I have it here, to ascertain the presence of psychological morbidity amongst medical undergraduates in India. Just people who are going to be doctors, who are studying medicine. Half of the medical students in India suffer from depression, anxiety, and stress measured at global standards. Half, 50%. This is not a small matter, Mr. Chairman. We have both Dr. Harshvardhan and Dr. Nadda sitting there, the eminent doctors. This is the process we're producing our doctors out of. They need trained professionals, and I hope that the bill will deliver trained professionals. I am concerned very seriously by the gap in our professional capacities at the moment. Psychiatrists are telling us that in a society where psychiatrists amount to 0.2 for every 1 lakh people, there is 1 psychiatrist in our country for 5 lakh people, Mr. Minister. Not to speak of a shortage of nurses, psychologists, psychotherapists, even NGOs working in the mental health space are few and far between. How can we rise to the challenge? We have to put this issue up higher on the agenda. We're discussing it on a Friday afternoon in a half-empty house. The truth is, this is an issue that is a national challenge. I certainly hope that you will also contribute, Mr. Minister, to building networks to seriously rehabilitate mentally ill persons who require constant assistance even after their treatment. Now, there are a number of good things in this bill, but they leave also a number of significant other issues out. Even when you talk about mental health professionals, psychiatrists, clinical psychologists, and even those trained in homeopathy, naturopathy, Ayurveda, Unani have been recognized in your bill, but psychoanalysts, psychotherapists, counseling psychologists, and others have not been included in the bill amongst the professionals who could help us and our people with mental health issues. I would request the Minister, when the bill is adopted, to bring in a small amendment and just add these categories. When you've mentioned so many and you've failed to mention psychoanalysts, psychotherapists, and counseling psychologists, it's a genuine omission and a rather serious omission. As you know, Mr. Minister, there will be no technical difficulty in just amending the bill at the moment of adoption with one small change, especially since we are going to continue this process on Monday, I understand. All around the world, these are people who are assisting mental health victims, and in various contexts, in the family, in schools, in hospitals, and so on. And the whole principle is that we should not only address mental health problems after they have emerged, after they've been diagnosed, but we should prevent individuals from going into depression in the first place. If you have counselors in the school system, if you have them in the medical colleges, you may be saving suicides, you may be benefiting India with future geniuses, future good doctors, and so on, because you have prevented them from committing suicide. Now, We have to help our children. We have to help our adolescents. We have to help all our citizens at risk, and therefore we need a wide range of professionals with a wide range of skills. And I think we need, Mr. Minister, to ensure that we create an infrastructure where mental health issues, even as they arise at the earliest of stages, can be addressed and resolved without having to wait for treatment at a later, more complicated stage. I'll give you one example from my home state of Kerala. I've been informed there by the Indian Association of Clinical Psychologists. Every individual who seeks mental health services, whether it's a child who has learning disabilities, somebody with serious psychiatric complications, is expected to meet with a psychiatrist. As I said, very few psychiatrists available, but you have to meet a psychiatrist. And that too only medical science professionals, those qualified with a medical degree, are deemed suitable. Those who studied behavioral sciences are treated as subordinate or inferior, whereas what we clearly need is a multidisciplinary, multi-pronged approach that takes advantage of all that is offered in different streams, branches, levels and layers of mental health discourse and practice, so that more holistic answers and solutions can be found. We want to address the issue and not to create another hierarchy of professionals when we're dealing with this issue. We already have a very hierarchical society. Let us not reduce mental health to again being stuck in a hierarchy of professional treatment. As you know, the bill is very broad in its defining terms, its definition. Even individuals with what could be deemed to be relatively minor ailments, such as memory orientation or mood disorders, are brought within its purview. Now, I think that's good. But if we're doing that, then we must also be able to provide a wide range of assistance at all levels, bring on board professionals with different kinds of skills and focus areas. And you know, in our society, it's not just a question of people in the drawing rooms or the offices that we all frequent. There are internally displaced persons whose lives have been devastated by natural calamities, by riots, people who have lost their homes, the Kashmiri Pandits who have fled. What we need is psychological first aid provided by relevant professionals. They cannot be herded into the clinics of psychiatrists. They'd be overwhelmed by the sheer scale of the problem. What we need, it seems to me, is different degrees of support for different kinds of professionals. You know that our military has been neglected. I've tried to raise the question in Parliament. It didn't get asked, but I think a written answer is coming. The military has a crying need for treatment for post-traumatic stress disorder. And it's not just after military engagements. Obviously, they have some real issues there. But even during prolonged periods of service in high-tension environments, such as the LOC in Kashmir, sometimes in Northeast and so on, they need psychological counseling. Tomorrow, sir, we cannot afford a situation where one of our soldiers, a man with a gun, becomes mentally disturbed. The consequences could be very serious for the morale of our armed forces. It is cheaper and wiser and more far-seeing to just have mental health professionals available in the army to counsel people in high-stress environments. Now, the bill is finally here with us, Mr. Chairman, after nearly 5 years of consultations. Clearly has promise and potential. It's far-sighted in looking upon mental health as a right and the delivery of mental health facilities as a responsibility of the government. And I hope the government now will allocate significant resources to this end. I do want to say that we have seen now 3 budgets from your government, Mr. Minister. Many essential things, particularly in the healthcare area, were cut in the first 2 years. This year you have succeeded in getting some healthcare money restored, but now that you're passing a mental health bill, please speak to your finance minister colleague to ensure that you will get the money you need to make this bill real and operational. Because we have seen such schemes being really let down by the present government. That debate is for another day, but the point is that the mental health institutions, you're setting up mental health review commissions to regulate patient admissions and so on. That's fine, but I don't talk only about resources for salaries for these people. I'm talking about resources for actually getting help to the victims. Now, the question of rights, violation of rights, my colleagues were mentioning and reacting when you were speaking, Mr. Minister. You know, you must appreciate that in our country very often, mental health hospitals, especially women's hospitals, are often packed with people who should not be there. They have been actually forced unknowingly, sometimes by their husbands, sometimes by family members, to be admitted under some pretext or the other, and we really must protect people against this. If the first resort is they live in their community, they live in their home and they get help, and it's only in extreme cases of danger to themselves or others, if they're harming themselves, harming others, then you put them in a mental asylum. But this is at the moment a very, very worrying and disgraceful practice. We should ensure that long-term hospitalization is only in extreme cases. Now, you have struck a good balance in the bill, Mr. Minister, between involuntary treatment and the rights of the patient. But the fact is that when you are talking, as you just did in your introductory remarks, about them nominating a person to decide on their behalf, now that is a bit worrying, because the fact is, who decides whether one is at risk of harming oneself or another? Who decides when you're well enough to nominate somebody else, or when you're not well enough that you need to nominate someone else? In practice, we're talking about a condition that many people are in denial about. If the people who are in denial are then expected to nominate somebody else, they won't do it because they say they're not ill in the first place. Then, if the nomination is coaxed under duress, or a signature is forged or anything else, you're suddenly subjecting a person to involuntary treatment. And I think that this is not going to be easy. I hope that you will be careful in drafting the regulations of this bill to ensure that it is not misused, because if we decide to disallow involuntary treatment, then we will be leaving out mental patients who have lost the capacity to judge their own mental state. But if we give people unsolicited powers to impose involuntary treatment, to lock up people, incarcerate people without adequate medical evidence, then we are actually opening the door to abuse and misuse. So by instituting review procedures for hospitalization and leaving room for medical institutions and family members to take action on behalf of a patient, I think we should really strike, Mr. Minister, not just in the bill, but in the regulations you will write to implement the bill, the right balance, the balance that we have lacked so far. And I do want to applaud you for the steps you have taken in this bill in that direction. Now, I'm glad that the drafting of this bill was inclusive. As the Minister mentioned, a wide range of people have offered comments, suggestions, expertise, civil society, medical professionals, and indeed, I think we should today appreciate the efforts of the previous government and Sri Ghulam Nabi Azad, who offered us a well-rounded bill, and of course to Minister J.P. Nadda for keeping up the momentum and bringing it to us today. The bill will inevitably require refinement from time to time because the world is moving on. The treatment of mental health illnesses is getting more sophisticated each year, and we have to keep being prepared to have to amend our provisions. But I do want to say that, the issue of mental health in our legislative process needs to find an important place, needs to accept the progress being made in today's bill, but also that newer methods and solutions may be found. Some may raise questions, Mr. Minister, are we overreaching? Is our society really prepared for a bill of this nature? Might it add to the stigma with which victims are seen? Legislation, laws sometimes have to take a leap, and we have to move sometimes not only with the times, we have to move ahead of the times. Just earlier today, somebody was pointing out the judiciary keeps moving ahead of us. Let us, for once, not give our friendly judges the opportunity to say that we are behind the times on something like this, and because of some PIL come up with new, farther-reaching things. Let's pass this bill soon, and let's make sure that this landmark legislation you have offered us today, Mr. Minister, is implemented quickly with good regulations and is kept open for amendment as we need in the future. I believe future generations will be grateful to us for having laid down a much, much improved marker for treating mental health. A couple of final points, Mr. Chairman. I do want to make one more request to the Minister, not to amend the bill, but just in your actions. I think you need to review the existing caseload of mental patients admitted in our institutions, because all those who are admitted now have been admitted under the old law, and that includes people who are involuntarily locked up and so on. You should give us a date, Mr. Minister, by when you can review these cases. I have been, as an MP, a case has been brought to my attention of a 46-year-old woman who was forcibly institutionalized. She was drugged unconscious by health workers brought by her doctor who said they were giving her a vaccination. Then she was taken. She was given forced medication, electroshock therapy. Somehow her friends and relatives went to the courts, and the courts ruled that she was not mentally ill and should be released. Thank God your bill does allow for the consent of the patient as well as approval from the concerned board before administering any electroshock therapy. But this is what happened to this lady. So if our existing laws and our existing societal biases against certain segments of people make it extremely easy to falsely institutionalize a person, then those who suffered under the previous law must not be left behind and forgotten when we pass today's law. And that's why I request you to order inspection